All right. So for those that don't know me, my name is Julia Frith. I'm with the Kentucky Infection Prevention Training Center. And today I thought that we could talk about what are the current events around the globe from an outbreak perspective. So what is happening around the globe with our outbreaks? Just as a reminder, funding for this presentation is provided by the Kentucky Department for Public Health. There's no discussion of unlabeled products. I have no financial interest or other relationship with manufacturers of products, and no commercial support was provided. So we'll start with Marburg virus disease. I think many on this Zoom today have heard about this outbreak that is currently occurring in Rwanda. So what is the situation? In October, the CDC issued a HON about the first Marburg virus disease outbreak in the Republic of Rwanda. There have been other outbreaks of Marburg across areas of Africa, but this is the first time that one has actually occurred within Rwanda itself. Health officials in Rwanda announced that on September 27th, there were cases in a healthcare facility located within the country. As of October the 2nd, there were 36 lab-confirmed cases, with 11 deaths and at least 19 of those cases being healthcare workers. As of October the 30th, the case count had risen to more than 60 cases, with 15 deaths. And according to the World Health Organization, this is the third largest outbreak of Marburg virus to date. Also of note, many of these individuals were healthcare workers that either did not have or were not wearing the appropriate personal protective equipment when providing care to individuals. So let's look at what is Marburg virus. Marburg is actually a pretty rare viral hemorrhagic fever, and it was first detected in 1967. It's similar to Ebola in the fact that it's a viral hemorrhagic fever. And the natural reservoir for Marburg virus is the Egyptian Rosetus bat, which is a fruit bat. However, Marburg, not unlike Ebola, can infect humans as well as primates. It's caused by an infection with one of the two ortho-Marburg viruses, so either Marburg virus or Raven virus. And it's ultimately really thought to spread through prolonged exposures to either the mines or caves that these Rosetus bats colonies reside, though it has obviously been linked to outbreaks that are associated with individuals that have not come into contact with those mines or caves. So there is some other form of spread. Not clear if that's from when these bats consume their food and maybe leave some of the contaminated food, contaminated urine, feces, those kinds of things from the bats. Once a human is infected, it can be spread human to human. And this is through contact with skin or mucous membranes of an infected individual or someone who has just died. Individuals who have died from viral hemorrhagic fever have a very high viral load, and that is when people are at very high risk, particularly during traditional burial processes to come in contact or become infected. The body fluids include sweat, breast milk, amniotic fluid, and then the body fluids that you would typically think of. It's also spread through contact with infected animals, contact with infected sharps or contaminated environment. It does live on the environment for some period of time. Thankfully, though, it is not spread through airborne transmission. The incubation period for Marburg virus disease is 2 to 21 days, which is not unlike many of the other viral illnesses that we'll talk about today. The symptoms are typically really rather sudden and are your typical symptoms that you would get from a viral infection. So fever, headache, just not feeling very good. Around day 3, individuals typically will develop the severe watery diarrhea. And from day 5 of the disease, patients may start to develop those hemorrhagic manifestations. Not all patients will develop hemorrhagic manifestations, right? Some will just have the severe nausea and diarrhea. In cases that are fatal, death occurs about 8 to 9 days after symptom onset. Now, the mortality rate for Marburg virus disease is really dependent on the care management and the available case management. So understanding how quickly the outbreak has occurred, and then quickly being able to provide care to individuals that are infected. There is no specific treatment for Marburg virus disease. There is currently no vaccine that is available. It's super important that, not unlike Ebola or any of the other viral hemorrhagic fevers, that patients' fluids and electrolytes are maintained. That include to prevent them from going into shock. Obviously, if they have bleeding, then you would want to replace any lost blood or that. There are little data, so this is kind of similar to Ebola as well, on the persistence of Marburg virus disease, or MVD, in survivors. They think that since ortho-Marburg viruses are similar to ortho-Ebola viruses, they're in the same virus family, that it can be assumed that ortho-Marburg viruses can persist in the same immune-privileged sites that Ebola virus does. And this includes the testes, aqueous humor, placenta, and central nervous system. So I thought this was really interesting. This is from the Rwanda Health Ministry site, and it shows the distribution of illness. So this is up to date since November the 3rd, and when I just went out there, it really hadn't changed. But it's nice to see. You can see how many confirmed cases, what their fatality rate is, which is thankfully relatively low. You can see the case profile. So obviously they had that spike, and then it started to go back down. And then by gender distribution, death by gender distribution, age group for cases, and also death. So what do we do from an infection prevention perspective for Marburg virus disease? We want to have rapid identification and triage. It is very important that we do a good travel screen. To date, there have been no reported cases of this outbreak outside of Rwanda. There have been no reported cases of Marburg in the United States. And actually, for this particular outbreak, individuals traveling from Rwanda are being routed through designated airports to be screened. And then state health officials are notified that those individuals are in the country and are being screened. We want to have immediate isolation. This includes those special precautions. We want to be sure that staff are aware of the correct PPE, how to put it on and take it off. As you'll see within this outbreak, many of the individuals that have become infected were healthcare workers, and PPE may have been an issue. Waste management is a category A, so it's important that you figure out with your waste management vendor how you're going to get your category A waste out of your facility, and do they have all the required certificates to transport that to wherever its final destination is. It's super important, obviously, that we have immediate notification of infection prevention, public health, and other key stakeholders when we suspect this is the case. You're probably not going to be sending, I won't even say probably, we aren't sending a test for Marburg down to your general micro department. There's work to be done to figure out if we need to have testing done, where that goes. Marburg virus disease may not be an illness that would be managed in all hospitals. You might send that patient out to a facility that is more more readily able to provide care for a patient with a viral hemorrhagic fever. To be clear, the risk to the United States with this particular outbreak is relatively low. So let's move on to Mpox. So this is a clade 1 outbreak in the Democratic Republic of Congo. So since January of 2024, the Democratic Republic of Congo has reported more than 33,000 suspected cases and greater than 1,000 deaths. While the clade 1 of Mpox is endemic in the Democratic Republic of Congo, this particular outbreak is more widespread than previous outbreaks, and it has spread to other countries, including your Central African Republic, the Republic of Congo, Rwanda, Uganda, and some other locations. There have also been some travel-associated cases where individuals traveled to one of these countries, and then when they went home, were found to be positive for the clade 1 Mpox. This is of interest because on August the 14th of 2024, the World Health Organization declared the outbreak a public health emergency of international concern. This is the highest level of global threat. So when we look at the two clades, I think that this is really important because we have been dealing with a global outbreak of clade 2 Mpox since 2022. More than 99% of individuals with clade 2 Mpox survived. It's endemic to West Africa, and it's usually less severe. Now, clade 1, on the other hand, is responsible for that current rise that's in Central and Eastern Africa. This one historically has caused severe illness or higher or more severe illness than clade 2, and up to 10% of the people could potentially die from it. Now, the recent outbreak, they have had much lower death rates, around 1 to 3%, but it is still clearly of concern. So when we look at clade 1, Mpox clade 1, it's really not a whole lot different than Mpox clade 2, or different really at all. It's caused by the monkeypox virus, and there are the two clades. It's spread through direct contact with infected animals, close contact, this is including intimate contact with a person with Mpox, and direct contact with contaminated materials. Usually incubation is within 21 days of exposure. And the signs and symptoms include rash, fever, and chills. The rash will go through several stages, including scabs before it heals. And it can initially kind of look like pimples or blisters, and it may be painful or itchy. There is no specific treatment. There are some options for treatment, but there's no specific treatment for Mpox. And the vaccine is available and is recommended for individuals that are thought to be at risk. Again, risk to spread within the United States for Mpox clade 1 is currently low. But what would we do, right, from an infection prevention perspective? So again, you want to have rapid identification and triage, making sure that you understand a good a good travel screen and HMP. You want to make sure that you isolate them appropriately. This would include gown, glove, eye protection, and an N95 respirator or higher. Interestingly, waste management is generally category B. Originally, waste management for Mpox clade 1 was category A, but there's been some update to that guidance, and since the review has been done, really the thought is that United States, we can handle the waste appropriately, and that it's okay for it to be category B. There are still some caveats to that. So where it would be category A, specifically around lab cultures and those kinds of things. But generally speaking, this is a category B. It's important that linen management is understood. You really don't want to agitate the linens. And so it's important that if you do have an individual with clade 1, that you have a process to notify your laundry facilities. You don't want them taking those linens out of the bag and maybe putting them up onto the conveyor belt to have them cleaned in such a capacity that would aerosolize anything within those linens. So some locations may just discard the linens. Some locations, just let people know. It's just really a decision that you would make with your facility. Cleaning and disinfection. So obviously you'd want to do that with a list from the CDC List Q, but also with Mpox Clade 1 as it relates to cleaning and disinfection, you're going to want to avoid like dry dusting, sweeping, or vacuuming. You really should do wet cleaning methods. So wet dust and mop the floor. As with all of our highly pathogenic infections, you want to make sure that there is immediate and swift notification of key stakeholders to make sure, again, that testing is done correctly and that it's transported safely. So let's move to the United States. And there is an E. coli 157H7 outbreak that was identified in the end of September. So in October of 2024, October 22nd, Taylor Farms, which is a producer of or a distributor of foods, voluntarily recalled some of the onions sent to food service customers. These were specifically the slivered onions that were served on quarter pounders and other menu items from McDonald's. Illness started ranging from September the 27th to October the 16th. This has impacted to date 90 people within 13 states. 27 people were hospitalized. 2 of those individuals developed hemolytic uremic syndrome, and there was 1 death. The death was not the individual with the hemolytic uremic syndrome. There were many McDonald's stores. You can see the light up across the map there that stopped using the slivered onions, and all of the recalled onions were removed from the shelves. McDonald's did confirm that there was no E. coli 157 in any of their products, like the beef that they use for that quarter pounder or otherwise. So E. coli 157H7 is caused by Shiga toxin producing E. coli, and it's spread through eating contaminated food or drinking contaminated water, contact with animals, their feces, or their environment, and contact with feces of an infected person. This is one of the outbreaks that occurs. Sometimes we think about it associated with petting zoos or something of the like. Incubation is normally on average about 3 to 4 days, but can be up to 8 days. And not everybody is going to have to require medical treatment or hospital care. Signs and symptoms include bloody diarrhea, stomach cramping, vomiting. Ultimately, it can cause hemolytic uremic syndrome, which is obviously impacts your kidneys. That is not the case in all cases, but it is absolutely one of the risks. Treatment, you really want to have supportive treatment. Obviously, individuals would require dialysis depending upon how their kidney function is. And most individuals actually recover with and have no issues after that. You want to be very careful with antibiotics in patients with hemolytic, with E. coli 157H7, as there is obviously a very high risk with using them. Again, from an IP perspective, you want to have rapid identification and triage. Good having a history and physical. If you have somebody that comes in and they've got signs and symptoms of a diarrheal illness such as this, understanding and asking those critical questions, where did you eat? What have you eaten? May help to understand what's going on. These individuals can be placed in standard precautions unless they have are diapered or incontinent. Cleaning is just a product that is effective against the pathogen. And again, in this scenario, you do want to notify public health officials, as it's important to understand if there is an outbreak that is occurring. So this is a notifiable disease or illness, rather. Next, I wanted to talk about Oropouche disease. Historically, Oropouche virus has caused outbreaks really around the Amazon basin. However, from late 2023 to 24, there have been outbreaks of Oropouche virus disease in several countries in South America and the Caribbean. There have also been some travel associated cases, but there hasn't been any local transmission. I show this image because there have been cases of Oropouche virus or Oropouche virus disease, rather, in Kentucky. These individuals were also obviously travel associated cases, but it is important to know just because of some of the impact that infection with this can have. So again, Oropouche virus is caused by the Oropouche virus, or Oropouche virus disease, rather. It's spread through and getting bit by the biting midge, which is also known as the no-see-um, and infected mosquitoes. Anyone who is living or traveling to an area where Oropouche virus is found and that has not already been infected is at risk for an infection. Signs and symptoms are pretty general. Fever, headache, chills, and joint pain. The treatment is supportive. There is no known treatment or vaccine for this. One of the critical factors here is infections during pregnancy. There have been reports of the virus being passed to the fetus during pregnancy, causing death or congenital abnormalities. Although we think the likelihood of Oropouche spreading wildly across the United States is low, and that's because of climate differences, the types of biting midges we have, the types of mosquitoes that we have. We have different lifestyles, such as we use air conditioning. There may be some cases that occur in limited areas, though it is improbable. We are still learning what it means from a transmission perspective on what type of preventative methods need to be taken. So from an IP perspective, if an individual comes to the hospital and they're suspected of having Oropouche virus disease, they would go into standard precautions. But from an infection prevention perspective, outside, it's important that an insect repellent is used that is EPA registered. Screens can be used. I thought this was interesting, though, that many of the commonly used windows or door screens, the screen holes are not small enough to prevent the no-see-ums from getting in. So you need much smaller mesh screens. Using a fan outdoors can help to blow it away. For blood donors, it's important to consider waiting 4 weeks after your illness has resolved prior to donating blood. And there's also considerations for spread through sexual transmission. There was a recent scientific report that suggested that the first time Oropouche virus has been found in semen of a person that had Oropouche, which raises the concern that there can be transmission in that regard. And so considerations should be taken with that. So we've talked about a few of the outbreaks where we have fairly good control measures in place. At a minimum, we know they're occurring. We have likely developed heightened screening. And so I wanted to talk this last bit about a suspected Lassa fever case in Ohio. I think it's important to discuss because, to my knowledge, there's not a known outbreak of Lassa fever occurring in West Africa, and yet we have an individual who is presumed to be diagnosed with it in the United States. So when we look at this particular case, this individual traveled to Iowa from West Africa. They were not ill while they were traveling. They were hospitalized, presumably placed in isolation, and unfortunately, they did not survive their stay. If this particular case is confirmed, it would be the ninth known case in the United States since 1969, and travelers returning from location where loss of fever is commonly found. So, what is loss of fever? Loss of fever is a severe viral illness that can come on quickly to someone who is infected. It's caused by the Lassa virus, and it's spread by the multi-mammoth rat, which is found throughout sub-Saharan Africa. Currently, only West African multi-mammoth rats are known to carry Lassa virus, but those, like any other rodents, breed very quickly, and they can carry the virus in their urine or droplets and contaminate the environment and locations where people's food or supplies are stored. Most people get Lassa fever by eating or breathing in the environment, either by touching of contaminated items, breathing in the air that has been infected by urine or droppings when they maybe are sweeping or cleaning the space, eating the animals that have been infected with the virus, and then getting it in their open cuts or stores. It can be spread with bodily fluids, human to human. Again, the incubation is not much different than any of the other viruses that we talked about. 1 to 3 weeks after the person is infected, not unlike any of the other viral hemorrhagic fevers, Lassa fevers. General signs and symptoms can be pretty similar to most symptoms, right? It's fever, tired, headache. Unfortunately, there's also the bleeding and shock. About 8 in 10 people who are infected, though, with Lassa fever have mild symptoms and are never diagnosed. For this particular illness, there is some level of treatment. Obviously, you want to have supportive care to make sure that you manage fluids. But then ribavirin is effective when given as soon as the individual becomes sick. From an infection prevention perspective for Lassa virus, it's important that, again, that you have rapid identification and include a good travel screen. I suspect that the facility in Iowa did just that because this individual was immediately isolated, and it seems unlikely that anyone else will become sick. Waste management for this, not unlike any of the other viral hemorrhagic fevers, is category A. You're going to want to make sure that staff are aware and have the correct personal protective equipment available to them. Cleaning and disinfection is on list Q. And again, you need to have your immediate notification of infection prevention, public health, and key stakeholders to understand management, testing, and the like. So in conclusion, we know that there are viruses that are endemic to different countries all around the globe. And these outbreaks are occurring all the time, right? If you have an incubation period of 21 days for the outbreak to be declared over, it has to take at least 42 days without a case. So these are not short-lived. And so it is important that we do really good travel screenings regardless of the time of year or what is going on, and understanding a good H&P to see what did patients do prior to seeking care. The CDC has a beautiful site that provides great resources for locations that are experiencing outbreaks and recommendations related to travel. And always, if you have a question or a concern about a patient that is seeking care from an infection prevention perspective, always reach out to your IP. That is all I have. Any questions for me?
I have a quick question. You mentioned that the Oropouche virus has been found in semen, I believe you said. Has there been any recommendations kind of similar to what they do with Zika, or what they recommend with Zika?
From a prevention perspective, there
Yes.
there are, the CDC has some specific recommendations that people could consider, abstaining or using some type of protection, waiting to get pregnant until a certain period of time has elapsed. Yeah, so those do exist.
Thank you.
Yeah. Any other questions? All right. Thank you all very much. Have a good day.